All right. Hello again, everybody, and welcome to our Friday Healthy Conversation series. I'm Mark from Ripen. We've been doing this every Friday at noon. We've had a different healthcare provider, wellness expert come and talk to you about how you can live better, live healthier. And this week we have Molly Seasholtz, a pharmacist with the Rhode Island Primary Care Physicians Corporation. And we're going to hear about medications in her presentation, diabetes. Don't sugarcoat it. If this is your first time and you're joining us on Zoom, we'd love to have your questions. You can submit your questions by pressing the Q&A button on Zoom. You can click that, or you can type your questions right into the chat. Type in your question, and Molly will do her very best to answer it. This presentation is being recorded, just so you know. We're also streaming live to the Ripen YouTube channel. And if you're watching us on YouTube, you can feel free to send us your questions that way as well. With that, I think I can turn it over to Molly so you can hear what it is you came to hear about today. Thanks.
All right. Thank you, Mark. Again, my name's Molly. I'm a pharmacist. Today, we're going to be going through a little bit more about medications for diabetes. So despite this virtual setting, I did want to make it as interactive as possible. So I will have some true and false questions as we go along. So if you could please use the chat box to put in your answer for those questions, that would be really helpful. And if you do have other questions along the way, please feel free to type them into the chat box, and I can answer them along the way or at the end of the presentation as well. So what we're going to talk about today is the medications that we use for diabetes, the benefits of these medications, as well as the most common side effects we see from the medications. We're going to go a little bit into how to properly store and dispose of your medications. We will talk a little bit about the recommended vaccines, specifically for patients with diabetes. And then lastly, what to do when you're sick. So it's good to know information about your medications. And so every time you go to the pharmacy or your doctor wants to prescribe you a new medication, there are certain questions that you should ask just to make sure you know all of the details about the medication. So first, what is the medication for? And so this presentation specifically is about diabetes medications, but of course it is good to know about all of your medications and ask these questions about any of the medications you're on. So it's also good to know how you should take your medication, when and how often. So some medications we recommend to take with food versus without food. Some medications are better to take in the morning versus the evening. So those are good things to know about your medications, just so you're getting the most benefit from the medications that you're on. It's also good to know what problems could you have from taking this medication. So unfortunately, all medications do come with side effects. So it is good to know what you may experience as far as side effects of the medication that you're on. Another question to ask is if there is a generic medication or a medication that may cost less. So a lot of medications these days do come as generic options, which are definitely cheaper. I will say that a lot of the medications we're going to talk about today do not have that generic option, so they tend to be more expensive, but we will talk about that a little bit more throughout the presentation. It's good to know what you should do if you forget to take your medication, and then potentially what labs you'll need to have done if you're on a medication. So some medications do require some monitoring as far as your electrolytes, so your potassium or sodium levels. We will need to monitor with some medications, and then also potentially your kidney function as well to make sure that the medications are safe for you. So medications are just one aspect of lowering blood sugars, but there are two other main things that can lower your blood sugars as well. And so you've probably heard this from the previous weeks, but besides medications, exercise can help to lower blood sugar, and that's because by exercising, it will make your body more sensitive to insulin, and insulin is what is responsible for lowering our blood sugars. So by exercising, that's going to help your body naturally to lower your blood sugars. The other aspect of blood sugars is your diet. And so I'm not going to go into too much detail about diet, but in general, some good things to note is having a healthy, balanced meal, and then also watching the amount of carbohydrates that you're eating, because carbohydrates are what is responsible for increasing our blood sugar. And so with exercise and healthy diet together, these can decrease the need for medications, but sometimes this won't be enough. And so if our A1C or our blood sugars are above our target where we want them to be, then we may need to turn to medications. So our first true and false question, again, if you could please type your answer into the chat box, Mark will be monitoring it for me. So true or false, everyone with diabetes is on the same medications.
I have a false. I'm going to say it's false.
Okay, you are both correct. So that is false. Not everyone is going to be on the same medications. And so there are a lot of different medications we have available to treat diabetes, and each one is a little bit different. And so the bottom half of the slide here is representing all of the different organs where these medications work. And so each one is a little bit different. Some work in the pancreas, in the brain, the kidneys, the muscles, the liver, or the gastrointestinal system. And so some medications work on multiple areas, some only work on one area, but each one is a little bit different and every person is different. So just because your friend is on one medication, that doesn't necessarily mean that you're going to be on that same medication. And we really do look at each individual person and choose the best medication that's going to be the best choice for them. Our next question, true or false? Metformin is often used to treat high blood sugars only because it is inexpensive.
I'm going to say that's false.
You're right. So metformin definitely is inexpensive. It has been around for a long time. So because of that, it is a generic medication and does not cost as much. However, that's not the only reason that we like to use it. This typically is the first medication we turn to for patients who have type 2 diabetes, and that's because it does work really, really well. And so as far as the A1C lowering we see with this medication is about 1 to 2%. It can also help with weight loss and reduce the risk for a heart attack. So these are other reasons why we like this medication. And so as far as how it works, when we look at the different organs that it works in, it's working in the liver, the muscles, as well as the intestines to lower our blood sugars. So multiple different organs of our body it's working. And so I will say the one caveat or downside to metformin is the side effects. So the most common side effect we see is gastrointestinal upset, most likely diarrhea. And this occurs more so when first starting the medication. And so because of that, we will usually start at a lower dose of the medication, make sure you're able to tolerate it before increasing to a higher dose. And so the other things with metformin, because it does get broken down in our body through the kidneys, we do have to check kidney function from time to time just to make sure that our kidneys are still working appropriately and that this medication is still safe for us. Our next true or false, you need to know how to treat a low blood sugar if you are taking glipizide, glimepiride, or glyburide.
Total shot in the dark. I'm going to guess true.
True is correct. So these three medications, glipizide, glimepiride, and glyburide, are in the class of medications called sulfonylureas. And they do work in the pancreas, and they stimulate the pancreas to release insulin. And as I said before, insulin is what is responsible for lowering our blood sugars. And so sometimes with these medications, we can see a side effect of hypoglycemia or low blood sugar. And so it is important for us to know how to treat a low blood sugar, which I will go through in the next slide. Another common side effect we see with this class of medications is weight gain. And so as far as the benefits, they do lower A1C about 1 to 2%. And because they also have been around for quite a long time, they're inexpensive and they are available as generic medications. So to go into a little bit more about how to treat low blood sugar or hypoglycemia. So the definition of a low blood sugar is a blood sugar less than 70. And some of the symptoms we might see when this is happening is shakiness, sweatiness, confusion, irritability, potentially blurred vision. But not everyone experiences these symptoms. So for each person, it's going to be a little bit different as far as maybe one symptom that's more prominent, or they might experience multiple of these. Everyone's a little bit different. But if you do see a blood sugar less than 70, that is a signal for us to treat. And so how we treat a low blood sugar is 15 to 20 grams of glucose. And some examples of this would be the glucose tablets, which you can buy over the counter at your pharmacy. And so you would have to take 3 to 4 of those tablets at once and chew them so that they start working quickly. If you don't want to buy those, there are household items as well that you can use to treat a low blood sugar. So things like juice or regular soda, so about 4 ounces of, orange juice is good, or regular soda. So not diet soda, because again, that doesn't have sugar. And in this instance, we want to get sugar into our bodies quickly. Other examples are 8 ounces of non-fat or 1% milk, or a tablespoon of sugar or honey are all good things to use. And again, really, we just want to get sugar into our bodies quickly. And so after we eat the glucose tabs or drink the juice, whatever it is you decide, you will want to recheck your blood sugar again after about 15 minutes, just to make sure that it has come up. And if it hasn't, if it's still less than 70, you're going to repeat the 15 to 20 grams of glucose, check your blood sugar again. And so once it has come up, you will want to make sure you eat a small snack, or if you're about to eat lunch or dinner, that's fine. You can just eat your meal. But if you're not about to eat a meal, it is good to have a small snack like peanut butter crackers or something like that at that time, just to make sure that your blood sugar doesn't go low again. And so it also is important not to skip meals, because that can increase your risk of having a low blood sugar. And then also physical activity, as I was saying before, can affect our blood sugars. So an increase in your physical activity level may also increase your risk of having a low blood sugar. Our next, true or false. The Gila monster led to the development of one of our newer medication classes used to manage high blood sugars. True or false?
So, folks, if you want to answer the questions, you can type your true or false response into the chat. We have one true. I'm going to go ahead and say true. It seems too cool to not be true.
You're right. That is true. So it's actually the GLP-1 agonist, or glucagon-like peptide-1 agonist medications were actually first derived from the saliva of the Gila monster, and they're a hormone that was found in that saliva. So just a fun fact about these medications. Some examples of them are Byetta, Bydureon, Victoza, Trulicity, Ozempic, and those ones are all injectable medications. However, there is one newer medication, Rybelsus, which has just hit the market recently, and that is the first oral medication in this class. Otherwise, the rest of them are injectables. And so these medications work in many different parts of our body as well. In the pancreas, in the liver, they actually also work in our brain to kind of signal our brains, telling us, to decrease our appetite, that we're not as hungry. They work in the stomach as well to slow down the stomach, which also kind of makes us feel full and helps to decrease appetite as well. And so because of this, the medications do help with weight loss, which can be a benefit for a lot of people with diabetes that do want to, lose weight. This can be a benefit for them. As far as the A1C lowering, we see about 1 to 1.5% with this medication class. They do not cause low blood sugars. And another benefit is they have been shown to reduce the risk for heart attack. So overall, this is a really good class of medications, and we do use them a lot. However, as far as the side effect profile, kind of similar to metformin, the GI side effects are more prominent, so nausea, vomiting, and diarrhea. And so for this reason, we do start at the lower doses with these medications to make sure you would be able to tolerate them. And then if needed, we'll increase to the higher doses if the blood sugars still aren't controlled. Okay, next, true or false? A new class of medications, including Jardiance, Invokana, and Farxiga, cause an increase in urination. True or false?
So that sounds like exactly the kind of thing that the little voice on the commercial says. So I'm going to say true. We got another true too from the audience.
Perfect. You're right. So Jardiance, Invokana, and Farxiga are sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors for short. And so they do increase urination because the way they work is through the kidneys, and the kidneys produce urine. And so basically they increase the amount of sugar that is removed through the kidneys into our urine. So they cause you to essentially pee out the extra glucose in your body. And so because of that, the way they work, it will cause you to urinate more frequently. And so besides just helping with lowering blood sugars, they also have been shown to help with weight loss, to help lower blood pressure. They do also have kidney protection and can reduce the risk for heart attack as well. They lower A1C about 1. And again, they do not, this class of medications does not cause hypoglycemia or low blood sugar. And so unfortunately, for the side effect profile for this class of medications, because they are working through the kidneys and into our urinary tract, we do see urinary tract infections or yeast infections most commonly as side effects for this class of medications. All right, next, true or false? The class of medications, including Januvia and Tradjenta, can cause low blood sugars.
I'm going to guess true. And we have a false from the audience, and it is false.
The audience is correct. That is false. So this class of medications, Januvia, Tradjenta, Onglyza, they are dipeptidyl peptidase 4 inhibitors, or DPP 4 inhibitors. They do not cause hypoglycemia. As far as kind of where they work in the body, it's in the pancreas and in the liver. The A1C lowering we see from this class of medications is about 0.5%, so a little bit less than some of the other medications we were talking about. But another benefit is that they're weight neutral. So we typically don't see weight loss with this medication, but we don't see weight gain either. So it's weight neutral in that regard. All right, true or false? pioglitazone should never be used to treat elevated blood sugars because there are too many side effects. Okay, so this is
False.
false.
Ah.
Yeah. So pioglitazone or rosiglitazone are in the class of medications called thiazolidinediones. It's a tongue twister there. And so they do have a significant amount of side effects. However, that doesn't mean we can't use them. So they work in several parts of our body, in the muscles, in the liver, as well as in the fat, to help lower blood sugars. And kind of basically what they do is help to make the insulin work better in our bodies. And so we see our A1C lowering of about 0.5 to 1.5% with these medications, and they are available as generic medications. So for that reason, they do tend to be less expensive than some of those brand name medications that I went through previously. But as far as the side effects, we do see weight gain and swelling of the ankles, as well as fluid retention or holding on to fluid with these medications. So that can be a downside. And they do also have a risk of cardiac events, fractures, and bladder cancer. So definitely some pretty significant side effects here, but that doesn't mean that we're never going to use them. We just typically don't consider them to be our first choice medication. All right, and I think this is our last true or false. So insulin should only be used as a last resort if you can't use any other medications. True or false?
Let's see what the audience says. We've got a false. I'm going to go ahead and say false.
Okay, the audience and Mark are correct here. So that is false. I know when we think of insulin, it can be kind of scary. And to be honest, I was kind of scared of insulin too before I knew anything about diabetes. But as I started learning a little bit more about diabetes, I realized that insulin isn't as scary as we think. And so I want to try to kind of shift your mindset and not have you think of insulin as being a really, really scary thing. Because I've been talking about insulin this whole time. It's a natural hormone that we make in our bodies to help lower our blood sugars. And so it really is the strongest medication that we can use to control our blood sugars. And it is the most likely to be able to get our blood sugars under control. And so it doesn't need to be the last line. In fact, when we do use it earlier on in the course of diabetes, that can help to preserve the pancreas and help, make the pancreas not have to work as hard. And so that can be helpful. And so there are different types of insulins out there. There are many, many different types of insulins. So I will go through each of the different ones. So first we have the rapid acting insulins. And so the picture at the top, we do see the black line is representing the rapid acting, or Humalog or Novolog are examples. And so these insulins do work very quickly within about 15 minutes, and they only last about 2 to 4 hours. And so because of this, we do typically use these medications when we're eating to help control our blood sugars for what we're eating. And so the next type of medications is the short-acting or regular insulin, which is the blue line. Examples of these are Humulin R or Novolin R. And so again, this type of insulin does also work pretty quickly, within about 30 minutes to an hour. It does last a little bit longer than the rapid-acting insulins, but we do tend to use these as well for mealtime coverage of blood sugars. The next type is intermediate acting or NPH insulin, which is the purple line on the graph. And this would be Humulin N or Novolin N. And so these medications do have work for a lot longer in our bodies. And so they, can work for almost 18 hours in our body with the maximum effect being at about 6 hours. And so we do typically use these to cover our blood sugars throughout the whole day, but we do have to dose them twice a day to make sure that we're getting appropriate coverage for the whole day. And so the last type is the long-acting insulins. So the green line is representing Levemir, and the red line is representing Lantus, Toujeo, Basaglar, or Tresiba. And these types of insulins we typically dose once a day to cover our blood sugars throughout the entire day. And so patients can be on one of these insulin types. They may be on multiple. It just kind of depends how controlled they are with their blood sugars. So each person is a little bit different as far as which insulin they're going to be on and how much insulin they may need. And so as far as side effects with insulin, a low blood sugar can occur. So again, knowing how to treat the low blood sugar is very important. And then we also may see weight gain as another side effect of taking insulin. All right, so that wraps up all of the different types of medications that we can use to treat diabetes. So next, I'll talk a little bit about medication disposal. So since we were just talking about insulin, and so that does require a needle for the administration of the medication. And so it's good to know how we dispose of those needles. So other medications that have needles on them are the GLP-1 medications. So Byetta, Bydureon, Victoza, Trulicity, and Ozempic all do have needles involved with them. And then the other place we see needles is when we check our blood sugar. And so the lancet that you use to check your blood sugar, which is the needle that pricks your finger, we also do need to dispose of properly. And so where we dispose of the needles is in a sharps container. So the red bin on the screen here is what a sharps container is. And you probably have seen them in your doctor's office, but if I had to guess, you probably don't have one at home. That's okay, neither do I. So you can use other things besides sharp containers, anything that's hard plastic. So an old laundry detergent container is good. Old Gatorade bottles or hard Tupperware plastic is okay to put the needles in. Also coffee canisters as well. So really anything that's just a little bit thicker material is good. And so you'll put the needles in there, and then when it's full, as long as it's secure, you can throw that container away in the regular trash. And so really, we just want to keep you safe as well as keep everyone else around you safe and make sure you're disposing of your needles properly. Then the other important aspect of medication is storage. And so it is good to note that some medications do require to be refrigerated. And so insulin, as well as those GLP medications listed here, do require refrigeration prior to use. And so it is good when you're picking up these medications to ask your pharmacist when it's okay for you to take the medication out of the fridge, and then also ask how long it can be out of the fridge. So each of them is a little bit different as far as how many days they're able to stay without refrigeration. So that's a good question to ask when you pick up your medication. And then, of course, checking your expiration date every time you use a new medication. And so I know some people tend to stockpile a lot of medication, or you get your next refill, but you still have a box left in your fridge. And so it is good when you pick up your next prescription to kind of put it in the back so that you're always using the oldest one first and rotating your supply, so that your medication doesn't expire and then you have to waste it. So it is good to always try to rotate your supply as well. Cost of medications, I did touch upon this earlier, and unfortunately, a lot of the newer classes of diabetes medications that we have available can be expensive. mostly because they are brand name medications, and they don't have generic available yet. So because of that, they typically can be expensive for a lot of patients. However, there are some ways that we can help to lower the cost of medications. It does depend what type of insurance you have. So for people who have commercial insurance, which is typically if you have insurance from your employer or you're not 65 years old yet. So if you have that type of insurance, there are manufacturer coupon cards available that can help to lower your copay. If you do have Medicare insurance, unfortunately, they do not allow for you to use manufacturer coupon cards, but there are other programs available based on your income. So Medicare Extra Help is a program that can lower the cost of all your medications. Specific medication manufacturers do have patient assistance programs available, and that can help cover the cost of those more expensive medications. But it is good to always ask your provider, your doctor, or your pharmacist if there is a less costly medicine. Each insurance kind of has different medications that they'll cover. So that's something to make sure you're asking your pharmacist or your doctor to see if there's a medication that may be less costly for you through your insurance. And then lastly, some providers do use samples of medications, which can be good as well to help lower the costs. So if this is an issue for you, if cost is a concern, please talk to your pharmacist and your doctor. We definitely want to help you to be able to find the best medication that you're going to be able to afford. Tips and tricks for taking medications. So in general, it's good to take your medications at the same time every day. And I think the best way to go about this is to use a pill organizer or a pill box. And that's shown in the picture here. So this one is pretty simple. There is one slot for each day of the week. But if you are on multiple medications that you have to take at different times of the day, there are pill boxes for that as well that separate it into morning, afternoon, dinner, bedtime. And so that's definitely helpful for a lot of people, and it can give you a visual of whether or not you took your medications that day. If you have a pill box and that's still not helping and you always forget to take your dinner time dose of the medication, another thing I like to recommend is using an alarm. So setting an alarm on your phone to try to help you to remember to take that dose. And so your pharmacist is definitely there to help you make a schedule for your medication that's going to work best for you and make sure you're getting the most out of your medications. And so if you do find you're having difficulty remembering your doses or you're having a lot of side effects to any medications, definitely don't be afraid to talk to your doctor or pharmacist. We're here to help you. And we want what's best for you. And if something's not working, we want to help you try to find a better option. So briefly to touch upon vaccines. So these two vaccines on the slide here are vaccines recommended specifically if you have diabetes. So the flu vaccine and pneumonia vaccine. It is flu season, so I do encourage everyone to go out and get their flu vaccine as well as the pneumonia vaccine if you haven't yet. And the last part of our discussion today is going to be about what to do when you're sick. So when you're sick, your body is under a lot of stress and your body is trying to fight off your sickness and it's making more sugar. And so if you have too much sugar in your body, that can be dangerous and can potentially lead to life-threatening situations or potentially hospitalization. On the other side of it, if you are sick and you're vomiting or having a lot of diarrhea and you're not able to eat or drink anything, that can potentially lead to low blood sugars. So if you are having a low blood sugar when you're sick, it is okay to drink fluids with sugar in them. This is not typically something we recommend. However, when you're sick, it is okay. It's also good to try to eat 30 to 45 grams of carbs every 3 to 4 hours. when you're sick to help prevent having a low blood sugar. But if you do find yourself having vomiting or diarrhea for more than 6 hours, it is important to contact your doctor. And so really it's good to have a plan with your doctor before you get sick so that when you are sick, you know exactly what you're going to do. And so the other thing about when you're sick is your medication. And so you definitely don't want to stop taking any of your diabetes medications without first talking to your doctor. And then when you're sick, you might also buy some over-the-counter medications to help with your symptoms. And so it is good to always look at the ingredients in the over-the-counter medications, specifically for sugar. And so a lot of the cough syrup or liquid medications that you may get do contain sugar. However, there are sugar-free options for a lot of them. So it's definitely good to buy the sugar-free options when you can. And then another thing, if you do have high blood sugar, it's also good to know that some cough and cold medications can increase your blood pressure. And so it's good to always talk to the pharmacist about which over-the-counter medication will be the best for you. And so we also want you to have a sick day kit prepared. And again, this is something that you can talk to your doctor about as far as if there's anything specific that they would like you to put in the kit. But this is just general items. So it's always good to have a list of important phone numbers. So the phone number for your doctor, your pharmacist, your close friends and family members, your emergency contact in case anything happens. Have that readily available. Have your medication list available. I always recommend for every person to have all of your medications written out, to keep it in your wallet or in your car and somewhere where it would be easily accessible. If you do have to go to the hospital or even to a doctor's appointment, it's good to have your medication list available. Thermometer as well as tissues are good to have when you're sick. Sugar-free cough drops, syrups, or throat lozenges. So again, as I was saying, the syrups that you can buy over the counter, cough syrup, do have sugar, but cough drops are another thing that also have sugar, but there are sugar-free options available. So glucose tablets and gel in case of an event of a low blood sugar, you do want to have in your sick day kit. And then extra food and drinks, so snacks, Pedialyte, those types of things for when you're sick to have. And lastly, it's good to keep a sick day journal. And so because our blood sugars are fluctuating more when we're sick, it is good to be checking them more frequently. So we recommend to check your blood sugar at least every 2 to 4 hours when you're sick. But if you're finding your blood sugars are consistently higher than 200 or lower than 70, it is good to check more frequently. And if you're noticing these persistently high or low levels, you definitely need to contact your doctor right away. And so when taking your blood sugar, it's good to write it down in your journal. So the time that you took the blood sugar, what the reading was, if you took any medications around that time, including over-the-counter medications, and then also writing down what you're eating and if you know the number of carbohydrates in the food you're eating. And so the last part about the sick day is checking your urine for ketones. And so when we're sick and we have high blood sugar, typically our body will use insulin to lower the blood sugar, but if there's not enough insulin available in our bodies to lower our very high blood sugars, then our bodies will use fat instead as energy. And so when this fat is getting broken down, it can cause ketones. And ketones are acids that can build up in our blood and that can be very dangerous. And so when there's a lot of these ketones building up in our blood, they can spill out into our urine. And so that's why you can check your urine for these ketones. And how you would do this is there are ketone strips that you can buy over the counter. And so you would just have to collect your urine and use the strip to determine how much ketones you have there. And so if you're seeing moderate or large amount of ketones, that could be a dangerous sign. And so you would definitely want to contact your doctor right away if you do notice that. Our key takeaways today, just to wrap things up. So we did learn about the different types of medications that can be used for diabetes. And we talked about the benefits and side effects of each of these. And it's important to know that not everyone is going to be on the same medications, and that's okay because everyone is different, and what works for one person might not work for another person, and that's okay. It's always good to be honest with your doctor, your pharmacist, and let them know if you're not taking your medication due to cost or side effects or another reason. We want to work with you to find the best medication that's going to be the best for you. And lastly, next time you're at the doctor, if you haven't already, just discuss a plan with them about what to do when you're sick so that next time you do have a sick day, you are prepared. And that is the end of my presentation today. I will be happy to take any questions if anyone has any.
I want to remind the audience that you can type in your questions in the chat or click the Q&A button and submit your questions. One question, Molly, you know, it's always, you're always told it's important to tell your doctor or pharmacist what medications you're already taking and when they prescribe a new medication so they know about interactions. Are there other things you should tell your doctor or pharmacist to kind of let them know about potential interactions? For example, if you're taking like vitamins or supplements, is that important to tell?
Yes, definitely. So not only is it good to have your doctor know about all the prescription medications you're on, but it is good to also tell them about the vitamins or supplements or over-the-counter items as well. And so I know not everyone, that's not your first thought when someone asks you what medications you are on to tell them that you take vitamin D. But it is important for us to get a full picture of exactly what you're taking just to make sure that we can choose the most appropriate medication for you and make sure that nothing is going to be interacting with the new medication.
Great. Well, that's great. Molly, I want to thank you for an excellent presentation today and all that good information. I want to thank our audience for joining us. Remind you that we will be back next Friday at noon with a new healthcare provider or wellness expert to talk about living well with diabetes. And with that, I would thank you again for coming and enjoy the rest of your afternoon.
Thanks, everyone.